Okay, moving on to the next part, that is the uses of insulin. What are the uses of insulin? Yes, insulin is used for diabetes mellitus type 1. We write it as DMT1. And also it is used for diabetes type 2. It is used for gestational diabetes mellitus, gestational diabetes mellitus, and it is used in emergency conditions. What are the emergency conditions we use this? Now, one emergency condition is the disease is diabetic diabetic ketoacidosis. So diabetic ketoacidosis, which is commonly seen in type 1 diabetics. Now here in treating diabetic ketoacidosis, we use IV regular insulin. So when you treat this, you have to give IV regular insulin. Right. So I told you only IV drug that is given is regular insulin. And should we give potassium here? Yes. If you give regular insulin only, what happens? There is chances of hypokalemia. So plus you have to give potassium chloride infusion when you are treating this case. Otherwise, the patient will suffer with hypokalemia. Second emergency condition is non-ketotic hyperosmolar, non-ketotic hyperosmolar diabetic coma. Now, this is very a complication that is seen in type diabetics. There also we use insulin. Now, third important condition is a case of hyperkalemia. So, hyperkalemia when you are managing, remember here also you have to give not insulin alone. Along with insulin, you have to give dextrose because the patient is come with only hyperkalemia. So, when you manage that, you have to give insulin plus dextrose. Now, moving on to the other conditions where we use, suppose a patient is on oral drugs for diabetes type 2, and immediately he has to be posted for surgery. So patient is under surgery, then we don't recommend using oral drugs. We give this insulin. Suppose the patient is under stress, or if the patient is having infection, so what we do is we shift the patient who is on oral drugs to insulin. So this is how we can combat this crisis. So these are the uses of insulin, that is diabetes type 1, type 2, gestational, and in emergency 3 conditions I have told you. Now next problem is the adverse drug reaction. Do we have any adverse drug reaction with the insulins? Yes, the most common problem what we face with this drug is hypoglycemia. So insulin, the major role is to decrease glucose. So among all the hormones, the only one hormone that decreases glucose is insulin. Now, how do the patient know that he is under hypoglycemia? The patient will undergo this hypoglycemia by certain symptoms will come to him. What are the symptoms? He will have tremors, palpitations, and he will be severely sweating. So these are the symptoms the patient will complain whenever he has hypoglycemia. So what they ask in the exam is also, how do you manage a case of hypoglycemia? Now, when you manage a case of hypoglycemia, you have to ask these things. Now, the patient is having tremors, palpitation, and sweating. First thing you need to assess is whether the patient is alert. If the patient is alert or he is able to drink, he is able to drink or eat. So if he is able to drink or eat, yes. So usually hypoglycemia will be occurring at a home. So what to do if the patient is at home? If he is able to drink or eat, he is alert, then what you can do is you can give sugar, that is stable sugar. You can give him honey. You can also use him chocolate, Or if there is availability of oral glucose, yes, obviously you can administer oral glucose. This will combat this. But if he is not alert or is not able to drink, not able to drink or eat, then you cannot give this. So immediately what happens nowadays, what we have is a preloaded glucagon syringe. So you can inject this glucagon IM. So nowadays patients carry this IM glucagon, that is glucagon preloaded syringe with them, and in the house somebody can inject this IM. If they are not able to drink or eat, then at home we can use IM glucagon. So next thing is, if the patient is unresponsive, he is not alert, he is unresponsive. Now if he is at home, then if he is unresponsive, he had to be given IM glucagon only. But if the patient is in hospital, if he is in the hospital, now it depends whether you can get an IV line or not. If you can get an IV line, so yes or no. If the IV line is no or yes. So if you can immediately get an IV line, then what you can do is you can give IV glucose only. IV glucose only. So this is at home, I told you. This is at home if he is unresponsive. Now if in the hospital there is a new resident who has joined and he cannot get an IV line, if he cannot get, then in the hospital you have to give IM glucagon. So when the patient comes to your emergency ward, assess whether you can get an IV line. If yes, you give IV glucose. If no, IM glucagon. Suppose the patient is unresponsive, he is at home, so immediately he can be given IM glucagon. If he is able to eat and drink, he is alert, then you can use any sugar preparation, that is sugar, honey, chocolate or oral glucose. These are all important. Now one important interaction I want to tell you is, insulin plus beta blocker. Now many patients will be given insulin and beta blocker together. Now what happens when we give beta blockers, particularly the non-selective beta blockers? Now what happens here is, many a times the patient will undergo hypoglycemic episodes. Now when he undergoes hypoglycemic episodes, he will have increase in sympathetic activity, and this sympathetic activity will stimulate the beta 1 as well as the beta 2. The stimulation of beta 1 is the one which is responsible for the palpitations. So it is the one which is responsible for palpitations. So that is the only thing. Now the stimulation of beta 2 is the one which is responsible for tremors, and also this beta 2 will work on the liver and it increases glucose. We call it as compensatory increase in glucose. So beta 2 acts on this liver and it increases glucose. So this is what we call as compensatory increase in glucose whenever there is hypoglycemia. Compensatory increase in glucose. Now another sympathetic stimulation what we see is sweating. So whenever the patient is having hypoglycemia, he will have these three complaints, that is palpitations, tremors and sweating, what we call them as warning signs. So this is what you have to educate a patient. If they have this warning signs, then they should suspect hypoglycemia. But what is the problem when we give beta blocker? When I use a beta blocker, it will block this beta 1 and beta 2. So what happens? The patient will not have a warning sign of palpitation and tremors. So what is the only warning sign they will have is sweating. Second problem is, when you block beta 2, this compensatory increase in glucose will not occur. And that's for the reason many patients may go for hypoglycemia. From hypoglycemia, they may go for unconsciousness, seizures, coma. And this will lead to permanent neurological deficits. So that's the reason you have to treat this very promptly. Very promptly. Right? Now, the problem is the combination will cause hypoglycemic unawareness. Even the patient has hypoglycemia, he will not know that he is hypoglycemic because there is no warning signs. The only warning sign is sweating. So you should be very careful when you are combining insulin with beta blocker, which is very, very vital.